Hey everyone, Kelly Jakes here. If you've been following me, you know I've been doing a mini series on women and our sexual health, particularly menopausal women, whether you're in that menopausal transition or just post-menopause, talking about our sexual health and our intimate wellness. Because through my blogs and blasts, I get every week women asking me different questions about their intimate wellness or sexual health. And part of that is because I wrote the book Martinis and Menopause, and chapter 10 is all about sex and the changes that we go through and what we can do about it to get our sexy back. So today it is my honor and delight to introduce you to Dr. Suzanne Deschamps. And she is known to me because she is my primary care doc. So with that, Suzanne, I would just like you to introduce yourself to the audience and let us know a little bit about your practice.
Great. Hi. Thank you, Kelly. Nice introduction. And it's an honor to help take care of you. A real honor. Thank you. So I'm a family doctor. I've been a family doctor for almost 25 years, originally from Canada. And my main goal is to kind of connect with my patients, find out what matters to them, and really focus on the preventative aspect of healthcare, what we can do as individuals to help prevent disease. And I see full spectrum care from newborns to have a couple 100-year-old patients, and I just enjoy caring for people at different stages of their life. Yeah.
Wow. That's beautiful that we have people such as you on the planet who care about their patients. And I would never guess you've been in practice 25 years. So it's great. I also love seeing women working in healthcare. So thank you. So would you talk to us a little bit about this focus I have on the menopausal woman? And as you know, that can be a transition of many years, but what do you see in your practice, women who come in, issues, that range from, let's say, 40-ish to 60-ish?
Right. And so that is, being actually in, the menopausal time myself, the big thing of being a woman is that, I feel like every decade there's liberation of, you know, caring less about the things that don't matter and starting to care about what really matters, which is your health and well-being. And so changes that I see are a lot of women, start noticing that their periods become more irregular, sometimes some mood swings, night sweats, hot flushes, and vaginal dryness, urinary incontinence, which is common thing that kind of occurs later on as well too. And the most important thing that I try to connect with my patients about is that this is a normal phase, and just like other phases in your life, from puberty to childbearing years to the menopause, that try to embrace it as much as possible as a natural phase. And definitely those hot flashes can be annoying, and the sleep disturbances, but there's certain things that you can do to help prevent serious symptoms, and a lot that we can do to help take care of things naturally.
Wow, that's encouraging to hear too about, we can use natural remedies, also sometimes medications, sometimes
Yes.
help. And that it's a phase. And I think that's a dichotomy women have a struggle with, where, yes, I'm in my next decade, right? As you were speaking of, 40s, 50s, 60s, and you do feel more free. I mean, I'm in my 50s and I feel really so much freer to be myself. I know my own sexuality better. I know my body better. I know what pleases me. And then to balance that with, yeah, but all these changes are happening from
Right.
aging, that
Right.
you see what
It,
I'm
it
saying?
Totally. And it is a balance. And I think like the childbearing years, 20s, 30s, especially if you have children, it is all about them and their wellness, and you try and fit in what you can as a woman to take care of yourself. And often we're the last ones to get the nurturing because you're taking care of so many other people. And the liberating thing that happens in your 40s and 50s is, as the kids grow up, there's more time to focus on, what do you need, what do you want, and so I think that, like, I enjoy this time period in women's lives because it is an opportunity to actually start focusing on, the next 30 to 40 years. And each woman that comes into my practice, has unique family history, unique health conditions. And so as we discuss, the changes or what's bothering her most at that time, we can kind of put things into context as to, her risk reduction. Because certainly when we talk about hormones, we want to be sure that we're taking into context that individual woman's risk for heart disease, stroke, blood clot, cancer, that sort of thing. So it really is a personalized care at each stage of their life.
Right, which I love. And that's, as you know, that's a lot what I teach is that self-care. You find
Yes.
some time to put yourself on the calendar. And yet I always stress, like you just said, that there are some seasons in our lives where, of course, we are more the caregivers. Others need us so much that it's hard to fit, some time in to really give ourselves some care. But as we get older, that self-care becomes so much more important because I mean, for me, it's all about in my 50s, how do I want to live in my 70s and 80s, right?
Right. And that it's real honor to be a family doctor because you do see people during different phases. And I have some 80 to 90, even like I have 100-year-old woman who you go into the room and she's smiling and glowing. And like, how can we live and age gracefully? And so much of it is what you're doing, Kelly, like the restorative sleep, the eating healthy, the exercise, the connecting with people that bring you joy. And so that part is such a big part of the picture.
Oh, yeah. Thank you. I love hearing that because that gives hope for women. There's so much we can do. And to me, self-care is not just acts, like not just getting a massage, right? Or going
No.
for a run. Self-care is, will you design your life that's to bring you health?
Yes.
So, can you talk to us, Suzanne, about, what do you say to the woman who comes to your practice and maybe she wants to give up on sex or maybe she misses her sex drive? I'm sure you see a wide range of women and different feelings and beliefs about their sexual self. But what's some of the things you might explore with a woman to help her if she, let's say, wants to have her sexual life rekindled or she wants to feel better with her partner?
Right. And specific to menopause, it's really actually normal to actually go through some libido changes and just have less kind of desire, more vaginal dryness, so it's uncomfortable, and that kind of leads to like a negative cycle. So I I always encourage people to listen to their body, like that they're the owner of their health and know their body's best. And so generally when something like this is happening, there's a reason for it. And so we kind of explore, is it uncomfortable? Is it because you're getting hot flashes at night and you're not sleeping well and so we kind of explore maybe what might be triggering that. And a lot of the time it is the vaginal dryness. And so there's a lot of over-the-counter lubricants that are helpful, like oil-based, there's water-based and silicone-based, and encourage women to try samples of a few different ones and see if that's helpful. Also to reassure her that this is normal. This is a normal kind of thing. There's nothing kind of wrong with you, that there's, there's reasons why you're feeling this way. And then we can get into some prescriptions that, estrogen cream has been shown to be very helpful in terms of kind of beefing up the vaginal tissues, not only to help with discomfort with intercourse, but actually like preventing urinary tract infections and urethritis, which is inflammation around the urethra. As what happens when we go through menopause is the estrogen levels drop, and so the tissues that normally are kind of puffy and more lubricated become thinner and drier, so we're more prone to tears, discomfort with intercourse, and then recurrent urinary tract infections.
All things we do not want.
Right, and the urinary incontinence as well too. So
Right.
I mean, that is, again, people don't come in and actually talk about that, but it's so common and so underdiagnosed and undertreated. And there's aisles of Depends and Poise, but we don't talk about it. And so it is very common. In fact, it's more normal than abnormal, and there are things you can do to help that as well too. But getting back to libido, another thing is mood swings and sometimes depression as well too. So that is something we always screen for, is and or if there's relationship issues, and I'm a big fan of digging into that and counseling and bringing those conversations up at the table with my patients as well too.
Wow, that's just phenomenal. I know the audience is probably thinking, how did Kelli find such a great practitioner? I want a doctor like that. She's going to send you to counseling, ladies. No, it's good. I'm in therapy myself, and it is. I would just like to say, Dr. Deschamps has been like so illuminating and so positive to talk to a family care practitioner such as yourself, who really wants to get into the individual. We're all so different. And I tell women that too, about how I go through menopause is going to be different than how you go through menopause, or the symptoms I experience may be different than yours. And to me, that's kind of like the overall message that you are giving, that yes, these things happen.
Yes, they happen, and you're absolutely right. Some people will say, "Oh, I just stopped my period and that was that," and others will go through spotting and missing and for years. And then some people have hot flashes for 10 years, and others will just have them for like a few months and that's it. So the things that you can do to help the transition, like help hot flashes, a lot of them are lifestyle things. So if you're smoking, quit smoking. If you are drinking a lot of coffee, cut down on caffeine, that can help. Exercise, maintaining a healthy weight, trying to get your body mass index, in the 20 to 25 region, that can be helpful too, because people may not know, but the excess weight in form of fat actually gets converted to estrogen. And so that can actually kind of prolong some of the menopausal symptoms, in addition, create higher risk for certain diseases.
Yeah, it really is a lifestyle. It's kind of like I tell my children, how you're living in your 20s and 30s is going to affect how you age in your 40s and
Yes, the
60s.
sun exposure. Yes. So
And,
things that
making exercise a part of your life.
Right, making it routine. Like if you can do that younger and prevent disease, it just helps so much more. And so much of what we're doing in healthcare these days is actually making up for kind of lifestyle issues that we did when we were younger. So, if we can prevent quitting smoking, if we can prevent childhood obesity, if we can prevent these things through healthy eating, exercise, just imagine, how we would be functioning now as a nation.
Yeah, would be fabulous. Yes, because I had my share of fast foods for a couple of decades.
Yeah,
You
we
know,
didn't know. I
we
mean,
didn't
there's
know.
been
Yeah,
pros and cons of all this information through the internet, and I definitely think now that we know, like, I mean, the dangers of sugar, the dangers of sitting too much sun, that, that we didn't know growing up unless you were, counseled on it by a healthcare
right,
professional somewhere else. So,
right. Well, it has been so illuminating spending these few minutes with you. I so appreciate it. I don't know if there's any closing statement you'd like to say to women who are listening and they're thinking about their own intimate wellness or their sexual health.
yeah, I would say, that have the conversation with your doctor, with your group of your female friends, talk about these things because they are normal and a lot of people feel uncomfortable talking about them. And there's lots of things we can do. In fact, the good old Kegel exercises that have been recommended for years are still the number one kind of treatment management for urinary incontinence, stress incontinence. And so, you know, th- there's things that you can do starting today to help a lot of the symptoms of menopause or pelvic relaxation syndrome, incontinence, that sort of thing. So thank you, Kelly, for inviting me. It's been a pleasure. Thank you.
You have been a pleasure so much. And that's the message, ladies. There's lots we can do to improve our quality of life wherever we are on our journey of aging. So thank you so much, Dr. Deschamps. And I'll see you on the other side.
Sounds good. Thank you.